Hello everyone, welcome to Raaonline. After a long time, I am meeting you again. Hope you are all doing well. Today, we will start with the hepatobiliary system. We will see about the normal histology of the liver, which is very important to understand the diseases that occur in the liver, functions of the liver function tests, and other investigations that help in the diagnosis of liver diseases, diagnostic approach to the liver diseases, hepatic injury and how the parenchyma of the liver responds to the injury, and our topic proper, the liver failure. Normal anatomy of the liver, it's the large organ and it measures 1.4 to 1.6 kilograms and it constitutes 2.5% of the body weight. It has a dual blood supply. The portal vein supplies 60 to 70% of the blood supply to the liver, and the hepatic artery, it constitutes 30 to 40%. And the liver has 4 anatomical lobes and 2 functional units, which is the right and the left hemiliver, and the surgeons, they divide the liver segments into 8. So this is the normal external appearance of the liver. Coming to the microscopy of the liver, the normal histology, the liver is divided into lobules which are hexagonal in shape. So 1, 2, 3, 4, 5, 6. So they are the hexagonal lobule, and the hexagonal lobule, it has the hepatic vein or the central vein radicle at the center. So this is an anatomical lobule of the liver, and the functional lobule is known as the acinus. So this is the anatomical lobule, and the acinus is the functional lobule, which is triangular in shape. So this is the triangle, and here the central vein, which was at the center in the lobule, is at the apex of the acini. I think I am clear. And the portal tract are at the base. Now, there are certain zones of the liver. That is, the acinus in turn is divided into 3 zones. The zones are zone 1, 2 and 3. Zone 1, 2 and 3. Okay. Zone 3 is around the hepatic central vein. So, these are the zones 1, 2, 3. This is the centrilobular zone, which is nearest to the central vein. This is the mid zone, and this is the periportal zone, which is well away from the central vein. So the entire thing is an hexagonal shape, is the anatomical lobule. Acinus is triangular in shape, and zones are 3, 2 and 1. Central, mid zone and the periportal. This is the microscopic view of the normal liver. So this is the central vein, and these are the zones of the liver. The zone 3 is very nearest to the central vein, zone 2 is the mid zone, and zone 1 is this is the portal tract, which consists of the hepatic artery, the bile duct and the portal vein. And we have the plates of hepatocytes, which should be usually 1 cell thick. So we have just 1 cell thickness. This is the plates of hepatocytes. They are arranged around the central vein, and in between we have the sinusoids, which are lined by the endothelial cells. This is the portal tract consisting of hepatic artery, bile duct and portal vein. This is the central vein. Around the central vein you have the arrangement of the hexagonal shape of the lobule. Again, this is the liver. It is divided into various lobules which are hexagonal in shape, and each hexagon we have the acinus, which is consisting of triangular in shape, which composed of portal tract at the base and central vein at the apex. This is again the cut section, hexagonal shaped lobule with portal tract at the periphery and central vein at the center. This is the corresponding microscopy how we see in the slide. Central vein, this is another lobule, this is another lobule. They are the plates of hepatocytes which are arranged around the central vein, and these are the portal tracts. So this is the classical liver lobule. it is drained by the central vein. Another picture. So, this is the central vein. These are the portal tract, portal vein, hepatic artery and the bile duct. The blood flow goes through and it's drained by the central vein. These are the plates of hepatocytes. This is an hepatocyte and here this space is known as the sinusoids. Zones of the liver, they are present within the acini. Zone 1 is close to the portal tract at the periphery. It is periportal and it is devoid of blood supply. And zone 2 is present mid zone, in between zone 1 and 3. Zone 3 is nearer to the central vein and it is totally lack of blood supply. So, the hexagonal arrangement of the liver lobule, periportal is zone 1, midlobular is zone 2, pericentral is zone 3 which is closest to the central vein. There are certain functions of the liver. Metabolic pathways are more common like gluconeogenesis, beta oxidation of fatty acids, nutrient digestion and oxygenation. Everything is more common in the periportal zone. Whereas glycolysis, lipogenesis, beta-catenin, WNT signaling pathways are all more common near the central zone. Injury, it is more commonly autoimmune hepatitis, iron overload, that is hemochromatosis, cirrhosis, biliary cirrhosis are common in this area, periportal region. Whereas non-alcoholic fatty liver disease, drug and alcohol toxicity, infection, fibrosis and all more common in the central zone. Zone 1 or periportal, it's abundant blood supply. Glycogen synthesis, glycogenolysis occurs here. Compared to all the 3 zones, periportal zone has the maximum blood supply. It is responsible for all these metabolism and drug conjugation also. Zone 2, intermediate blood supply. It shares the works of 1 and 3. 3 is closest to the central vein. Poorest blood supply, metabolism of drugs and chemicals occurs, formation of lipids and pigments occurs in this zone.